It is the well-known fact that being physically active is beneficial to your health and also helps reduce many illnesses. Yet even with this knowledge, not many pregnant women remain physically active throughout their pregnancy. The American Congress of Obstetricians and Gynecologists have guidelines for pregnant women to remain physically active for at least 30 minutes a day for most days, if not all days of the week. Many women may not know this, especially with the belief that exercising during the pregnancy may harm the fetus.
Literature review shows following attitudes and beliefs and myths related to physical activity among pregnant women. I do not have time for physical activity. Too much activity can lead to early labor. The physical activity will result in a small-sized baby. I am scared, injure the baby, and can result in death. I am tired and lack of energy to do any physical activity. I'll be more tired after doing these activities. There's no one to take care of my children. I do not know what type of physical activities are considered safe during the pregnancy. The healthcare provider, by introducing this policy, will help the pregnant to develop positive attitudes, eliminate myths, educate them about the health benefits and different forms of safe physical activity, and motivate pregnant women to perform these activities most of the days in a week as recommended by ACOG guidelines.
The policy change we are proposing is to add in counseling, dieting programs, and educate them about physical activity guidelines to every woman during their initial pregnancy visit,
and will continue throughout their pregnancy and postpartum.
The policy changes may begin locally, move towards insurance companies, then become a state-wide policy for Texas. Our target population are Hispanic women with low socioeconomic status in the lower Rio Grande Valley. By encouraging the women during their initial consultation to become or remain physically active for at least 30 minutes a day, it will save the insurance company the city money and reduce the length of postpartum hospital stays. By being physically active, the mothers have a 44% reduce in pregnancy costs. The city saves money that has been set aside for Medicaid and other public insurances through the shorter hospital stays and reductions of payouts towards the hospitals and doctors. Thus, the money saved can be used for future education towards women and the funding of preventing further illness. This policy will help reduce the chances of obesity, diabetes, hypertension, and other diseases and disorders that may occur. This not just helps the mother, but also extends towards the child.
With the lack of physical activity and the lack of education about the proper guidelines by the ACOG, a fetus may develop birth defects. And additionally, the mother may develop gestational diabetes, which increases her risk of getting type 2 diabetes within 20 years by 60%. Just recently, pregnant Olympian runner completed and qualified in the 100-meter dash, just short of 30 seconds of a personal best record.
Look at this. Five-time national champion Alyssa Montano competed in the 800-meter run for the U.S. Track and Field Championships. It was just a normal race for the 28-year-old, other than the fact that she is 34 months pregnant.
Physicians recommended Alyssa Montano to remain physically active throughout her pregnancy. As can be seen, she and her baby are healthy and she is a few weeks from giving birth. Through our policy, we will increase physical activity among pregnant women so babies will be born healthier and the mothers remain healthy throughout the pregnancy by following the proper guidelines set by ACOG and IOM.